Hi, my name is Giselle. I'm going to be your nurse today. Can you state your name and your age for me, please?
Gabby Chavez, 25 years old.
Hi, Gabby. So today you're in for a cardiac and peripheral assessment. It's a very detailed assessment, so I'll be palpating and listening to like multiple areas. So if at any time you need me to slow down or stop, please let me know. Okay? Okay, let me sanitize my hands and we can begin. Let's start with your upper extremities. Here, I'm looking for symmetry. And your both hands are symmetrical to each other. Now I'm looking for your hair distribution, which is normal for you. And then I'm touching for your temperature is warm and your skin is dry. Now I'm going to assess for your skin turner here. And it bounces back in less than 3 seconds. That's very appropriate for your age. Now I'm going to be palpating your pulses. There's your radial pulses and your brachial pulses. Let's do one more thing, Gabby. Close and grab my hand, the hand grip. Strong and equal. Very good. Now I'm going to be moving on to inspect your carotids. No lumps, no bruises, or any marks. Everything looks good. Now I'm going to palpate, and this I'm going to do one at a time because I don't want to cut any blood flow to your brain. Okay? Let's start on this side. Very good. Now I'm going to listen, and what I need you to do here is for you to take a deep breath in and blow all your air out and then hold it. Okay? You ready? Hold it. And here I'm listening with the bell part of my stethoscope. And now we're going to do the same thing on your right side. Then out and hold it. Very good. Everything sounds good. Okay, Gabby. Now I'm going to be palpating your chest area here, and I'm going to point out some stuff to you. This is going to be your right intercostal space, and here we can find it, your aortic area. This is your left intercostal space, and this is your pulmonic area. This is your third intercostal space. Here we find the Erb's point. Your fourth intercostal space, we found the tricuspid area. And then mid-clavicular, fifth intercostal space, we found the mitral valve area. Okay? I palpated. Now I'm going to listen first with the diaphragm part of my stethoscope, and then I'll do it again with the bell part. Aortic, pulmonic, Erb's point, tricuspid, mitral area. One more time with the bell part. Aortic, pulmonic, Erb's point, tricuspid, and mitral area. Okay, very good. Now I'm going to ask you to lay on your back. And here, the first thing I'm going to ask you is to look my way. I'm here, look my way. All the way here, I'm looking for any yogular distension. There's none. Now look the other way. No yogular distension either on either side of your neck. Now I'm going to assess your precordium, which is your chest area here where your heart is. And then here I'm just looking for any bruises, bumps, any mass or anything abnormal. Everything looks normal for you. Okay? So now, Gabby, I'll be listening and palpating the same areas I just did what you were seeing. Okay? So we're gonna do right, second intercostal space, aortic area, left, second intercostal space, pulmonic area, third intercostal space, Erb's point, fourth intercostal space, as your tricuspid area, and here, mid-clavicular, fifth intercostal space is your mitral area. Now I'm going to listen, just like I did before. First, with the diaphragm part of my stethoscope, we go in aortic, pulmonic, Erb's point, tricuspid area, mitral area. One more time, the Bell's part, aortic, pulmonic, Erb's point, tricuspid, and mitral area. Now, I'm just going to need you to lay on your left side, in this way. Here we go in, like I said before, mid-clavicular, fifth intercostal space, and I'm just listening to your mitral area. It's the difference you're like laying on your left side. Very good. You can go back on your back. And now I'm just going to be assessing your lower extremities, and that's how it's going to conclude our assessment. Okay? Here, your lower extremities, I'm looking for symmetry. They look symmetrical, normal for you. Then I'm looking for your hair distribution on both legs. They look equal. Next, I'm looking for any varicose veins. There's none. Now I'm palpating for the temperature of your lower extremities. You're warm to touch and dry. Now, let me palpate for any edema. There's no edema noted. One more thing, we're going to do your pulses. And these are your femoral pulses, popliteal pulses, posterior tibial, and dorsalis pedis. Okay, everything looks normal. Now you can sit up. That will conclude our assessment. Do you have any questions for me? No. Okay, very good. I will be giving report on a 25-year-old female who came in for a cardiac and peripheral vascular assessment. We started the assessment off by inspecting her upper extremities. Bilateral arms were symmetrical with good hair distribution, warm and dry to touch, with skin turgor bouncing back appropriately for her age. Bilateral hand grips were strong and equal. Radial and brachial pulses were palpated equally bilateral. Then carotids were inspected bilaterally, one at a time, and there was no lumps, bumps, bruises, or pulsations noted. I proceed to listen for any murmurs or thrills. No abnormal sounds were noted. I auscultate her heart in a sitting position with the diaphragm and the bell part of the stethoscope. S3 and S4 normal heart sounds were noted. I educated the patient for each area and location of the heart valves. Then I did the same assessment while the patient was in a supine position. No murmurs or thrills were noted. Then I assessed her jugular veins for any distension, and none was noted. Her pericardium was inspected for lumps, bumps, bruises, or pulsations. None were noted. All areas of the heart were palpated without any tenderness or any pulsations. Auscultation to her apical pulses at the fifth intercostal space, at the midclavicular line, in her left lateral, at the midclavicular line, the mitral valve at the fifth intercostal space was done without any abnormal sounds noted. Then I moved down to her lower extremities. Bilateral legs were symmetrical. She had bilateral and equal hair distribution, no varicose veins. Her skin was warm and dry to touch. No edema palpated or extremities on either extremity. Bilateral, femoral, popliteal, posterior tibial, dorsalis pedis pulses were palpated and they were equal and strong.